for the time being.
Okay. Christian. Right hand. Yes. 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 Okay. I, Dr. Andrew Ekesa Wamalwa, of National ID number 2290-5849.
Having been duly nominated to serve as County Executive Committee member of the County Government of Bungoma.
Do hereby solemnly...
Sorry, just repeat what I've said.
Sorry.
Having been duly nominated to serve
Having been duly nominated to serve
as County Executive Committee member of the County Government of Bungoma.
as County Executive Committee member of the County Government of Bungoma.
Do hereby solemnly and sincerely swear
Do hereby solemnly and sincerely swear
that the information that I shall give before this committee
that the information that I shall give before this committee
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
So help me God.
So help me God.
Kindly take your seat so that you are able to sign the oath.
Thank you.
So, Doctor, that's Andrew Ekesa Wamalwa.
Yes, Chair.
Yes, kindly pass over your documentations to my officer for verification purposes,
Yes.
including the ID also. We may be handling a stranger like an imposter, so we need to know that you're the real one, not the masquerader for that purposes.
Yes.
So we are going to ask you questions, but before that we'll make some very brief introduction.
Yes.
I'm the chair of the committee on appointment by virtue of my office as the speaker. I'm Honorable Emmanuel Situma. With me I have honorable members. From Honorable Stephen, you go.
Thank you, Honorable Chair. I'm Honorable Stephen Wafula Wamalwa, member of this committee.
Thank you, Chair. I'm Honorable Joseph Nyongeza Juma, member of this committee.
Chair, I'm Joan Kirong, member of this committee.
Chair, I'm Anton Lusanaka, member of this committee.
Chair, I'm Evelyn Mutiambu, member.
Chair, I'm Vitalis Wangila, member of this committee.
Chair, I'm Honorable Chemion Masai, member.
Muhongo Barasa, a member.
Chair, I'm George Makari, member of the committee.
Chair, I'm Sunduka Grace, member of the committee.
Thank you. We'll be able to ask my clerk, deputy clerk, legislative and chamber services to introduce your member of the secretariat.
Thank you, Honorable Chair. My name is Momos Leona, the deputy clerk, legislative services. With me, we have other members of secretariat introduce themselves.
Chair, I'm Elijah Odera, research officer, member of the secretariat.
Caroline Wamalwa, deputy Hansard editor, member of secretariat.
Thank you, Chair. I'm Edward Musumba, legal counsel.
Thank you, Chair. Diera Galisa Swanjala, Chief Sergeant at Arm.
Chair, my name is Joktan Kabey. I'm Senior Clerk Assistant Committee Services. Thank you.
Chair, my name is Ruth Wanami, Senior Clerk Assistant, a member of the Secretariat.
Thank you, Chair. I'm Misiko Mash.
You hand over the mic, it's okay? Yes. It's okay, thank you. Our nominee before us, we've confirmed you are Andrew Wekesa Wamalwa.
Yes, sir.
We are going to ask you questions in shifts from the chair. The honorable members will be having some rejoinders, seeking clarifications from you.
Yes.
So I'll start by asking you a very simple question that give us a summary of who is Dr. Andrew Wekesa or Wamalwa Wekesa for that purpose.
Thank you, Chair.
It's okay, you can proceed.
Thank you, Chair. My name is Dr. Andrew Wekesa Wamalwa. I'm a Kenyan citizen, born in the year 1983. I'm 39 years now. And by profession, I'm a family physician. About my history, I was born in the year 1983 in the larger Lugari district by then. Now it's Likuyani constituency. To primary school teachers. My mother and my father were both teachers. I was born with good health, no problems. I schooled in Lugulu Primary School from class 1 to class 8. I went to Musingu High School from Form 1 to Form 4. Later, I did proceed to the University of Nairobi, where I pursued my undergraduate degree for medicine. After that, I chose to come to Bungoma County Hospital, where I did my internship for 1 year. After that, I was posted to Samia District, my first assignment as a medical officer of health, where I served for 3 years. Later, I was posted to Sirisia Sub-County Hospital. Sub-County, I also served as the Sub-County Medical Officer of Health. Thereafter, I was posted to Webuye East as Sub-County Medical Officer of Health. I served for 2 years. Later in the year 2017, I was posted to Kimilili Sub-County, where I served in 2 capacities, as the medical superintendent of the hospital, as well as the Sub-County Medical Officer of Health. In my journey in academics and my profession, I've served in various leadership positions, as I've said. First, I was recognized to be a leader in primary, where I served as a class monitor from class 1 to class 5. Thereafter, I was made the sanitation prefect in class 6, and in class 7, I was made a school head boy. In high school, in Form 2, I was made the library prefect, and in Form 3, I was made the library captain. At the university also, I became a leader through an elective process, where I became the congressman of the halls of residence. Therefore, in my capacity as a medical officer of health and also as a medical superintendent, which spans for more than 7 years, I have gained enough experience to manage health services, to interact with various groups, various communities. I've traveled abroad. I did my master's in Cuba. I came back last year, and I've had that international experience to see how the world is managing health, and I can compare with the Kenyan situation, and I believe I can serve the people of Bungoma well in that capacity.
What's your position now in the hospital?
In the hospital currently, I work in the Department of Family Medicine, where I'm a family physician.
You are a family physician?
Exactly, Chair.
Do you yourself have a family?
Yes, Chair.
You have a family?
Yes, Chair.
Your form is indicating that you are a single.
Chair, being single means I've not legalized my union, but I'm in a stable union. I have children.
How can you have children when how can you be in a stable union when you are single? What are you telling us? That you are single, but you are in a union? Are we normal in what you are hearing from you?
I've not legalized my union, Chair.
Whether it's under customary law or whichever Mohammedan law, a marriage is a marriage to us. If you look at the Marriage Act of 2014, a marriage is a marriage. When you say you are single, it means you are not having even any relation with any woman in this world. That's what we're understanding.
I will formalize.
You know why I was asking you the issue of department? You are saying you are a family physician,
yes,
but yourself you are single.
Honorable Speaker, maybe, and you know, even when you write you are single, prospectors are now many. In fact, I was proposing my sister. Because
now, second, are you temperamental?
No, I don't believe so.
You are not?
I'm not.
You know the opinion I'm having, which is very confidential, that you are very violent. That's why you cannot stay with anybody. Number two, that you are basically, any time you have had a partner in the house, you engage in a domestic violence.
I'm not aware of such, Chair.
You're not aware?
I'm not aware.
Do you reside in Samoa?
I do, Chair.
I think I'm not mistaking you then. Honorable, before I now go to that issue, your nomination is for a CECM.
Yes, Chair.
For health. Okay?
Yes, Chair.
You've been able to move around, you've traveled and you've learned a lot. Now, under Article 183 of the Constitution of Kenya, what are your major roles as a CEC?
Okay. Chair, under Article 183 of the Kenyan Constitution, as a CEC for health, my roles will be to legislate, ensure legislation for county health services, as well as supervise the implementation of national legislation that pertains to the county health services. And in that regard, you know that health is a devolved function. We have the county health services, under which you have the county health facilities and pharmacies. We have the cemeteries and crematoria. We have the public primary health care. And also we have the refuse disposal and solid waste management.
Honorable Grace Undukwa, you go.
Thank you, Chair. You have previously served in Funyula, Busia County, and also as a medical superintendent in Kimilili Sub-County Hospital. This committee is interested in understanding the circumstances that lead to you exiting of these two facilities after a very brief period of service.
Through the chair, I was posted in Samia District in March 2010. I served there for the remainder of 2010, 2011, and I left 2012 in June to Sirisia. Why I left was because of normal reshuffles at the province level. I didn't have a choice. I was posted to Sirisia and had to abide by the posting order. To Kimilili, I went there in 2017, October. Luckily enough, I was awarded a scholarship through the national government in June 2018, and therefore I had to leave the station to go and pursue my master's in medicine.
Yes, Honorable Muhongo.
Thank you, Honorable Chair. In the recent past, the governor came and gave his address in this Honorable House. I think you are aware of the content. If you are not aware, I have a question. He committed it to improve primary health care services through upscaling of county health care facilities, as well as upgrading and expanding level 1 and level 2. How will you assist the governor to achieve this?
Through the chair, I understand the manifesto of the governor and this commitment to improve health services in Bungoma County. All of us that reside in Bungoma County, we know the challenges that are facing our people. Our people, at the moment, we have a population of around 1.8 million people, and out of that 1.8 million people, 1.4 million people reside in the rural areas. 80% of people of this county seek health services in level 2 and level 3, which is dispensary and health centers. So the governor's focus, and that's my mandate, is to ensure that we uplift and upgrade the level 2 and level 3 facilities to ensure commodity security, that's non-pharmaceuticals and drugs, seamless supply of those commodities, and to ensure that staff at those facilities are present to take care of our people. Also, the community healthcare workers, they're integral in the management of healthcare services. The governor is very particular about motivating and remunerating the community healthcare workers. At the moment, we have 3,540 community healthcare workers who are spread in 354 community healthcare units. Out of that, only 26 are not captured in the monthly stipend. We will ensure through our budget that the remaining 26 community units are covered. Those are around 260 community healthcare workers are going also to be given stipend.
Yes, Honorable George Makari.
Thank you, Chair. Dr. how are you?
Fine, sir.
Good afternoon.
Good afternoon too, sir.
Chair, Dr. Amalo comes from Kandui, and precisely from my ward, but I'm not conflicted in any way. Dr. You've served as an assistant director of medical services in Bungoma County. You've been a superintendent, Kimilili, you've been in Busia. You seem to have risen so fast through the ranks. What sets you aside from others that you are able to rise so fast through the ranks?
Through the chair, first I think the favor of God, and secondly, I believe I'm a team player. I believe I'm hardworking. I believe in achieving the results. I've been in Samia. I was in Samia for 2.5 years. In my tenure, we managed to open and operationalize 6 dispensaries with the support of the member of parliament for that constituency. When I moved to Sirisia, again, we found that the CDF had put up 6 facilities which were not opened, and through the support of the national government, together with the member of parliament, we were also able to operationalize those facilities. When I went to Webuye East, again, we found that the members of the county assembly had tried to put up facilities, and we operationalized 3 of them. I'm a person who believes in serving the people. I believe in bringing healthcare close to the people. Wherever I've gone, I've left a mark to the people. When I was in Kimilili, we went there when the drug shortages and people are running away from Kimilili coming to Bungoma for services. During my tenure, as short as it were, I managed to reverse that. Now Bungoma was coming to Kimilili to learn from us. How is it that we're having drugs in the facility? How is it that our store for non-pharmaceuticals was always full? And by then, even the governor was very pleased with our performance as a hospital. So I believe I work hard. I believe I achieve. And also the favor of God is upon me.
Thank you, Dr. Maybe That's a plus for you. Now, doctors are known to have what we call attention to detail. You know that?
Yes.
Do you have that quality, attention to detail?
Through the chair.
Inaitwa thoroughness and attention to detail.
Through the chair, I believe I'm very keen. I pay attention to every detail that I come across.
If you really paid good attention to detail today morning when you woke up, how many patterns did you pattern today? Without looking at your shirt.
Through the chair.
You've confirmed you pay attention to details.
Yes.
Just answer that simple question.
Don't look at the shirt that you patterned today morning. Just look up and say, I patterned 6 patterns today.
Through the chair. As a doctor, we are trained not to lie. If I say the number of buttons, I'm lying because I've not counted the number of buttons.
That is not attention to the doctor.
I'm honest. I'm honest.
It's all right. It's all right. That was just it was just testing your attention to detail quality.
Yes.
So let me go back to my substantive question, Dr.
Yes.
And maybe before I do that, who is the current nominee for the CS for Health, your counterpart at the national level and the PS?
The substantive Cabinet Secretary for Health now is Dr. Susan Nahumicha, and the nominated members for permanent secretaries are 2, Engineer Peter Tum for Medical Services and Madam Josephine Mburu, Minister for Quality Assurance, PS for Quality Assurance.
That's good. Now, my question, the department on which you have been nominated for appointment as CC member runs the biggest recurrent budget, mostly towards employee remuneration. What measures will you put in place to achieve optimum revenue collection from the various health facilities across the county to facilitate the recurrent expenditure? Maybe I can repeat, Dr. Can I repeat?
I've gotten the question.
And while at it, this sub-department of public health, there is one time when we were doing our health overview, the department had money in the account, but the money, they could not spend that money. I don't know if that situation has changed or is still the same. The sub-department of public health collects money, puts in an account, but they can't be able to spend the money at all. I don't know if that situation was reversed or is still the same. So just back to the question, but at the tail end, you can put in that one of public health.
Through the chair, about health financing. This has been a thorny issue during devolution process. We have had many hitches here and there, but at the moment, Bungoma County is one of the model counties in terms of health care financing. Why am I saying so? Is because this House was able to pass the Bungoma Health Services Act, which creates the Health Services Fund, which enables the facility to collect user fees and seek authority to spend the money at the same facility for recurrent expenditure that's on medicines and pharmaceuticals, and also for facility improvement. Having said that, we know that collecting money, this depends on what you have, the service you have given to the client. As it is, many facilities are not able to collect enough because of frequent shortage of drugs, frequent shortage of non-pharmaceuticals, so that when patients go to those facilities, instead of getting the service and pay for the service, they have to go either to private or come to Bungoma County Referral Hospital for the same services. So one of the things we want to endeavor is to ensure that there's constant supply of drugs and pharmaceuticals and healthcare workers in those facilities so that they're able to render services and clients are going to pay for the services. 2 is automation of revenue collection. As I sit here, I know there are 2 or 3 peripheral facilities like Bumula and Sirisia who have not automated their revenue collection in the facility. And given chance, we are going to ensure that also in those peripheral facilities, they're able to automate the collection. Another opportunity is NHIF. NHIF has come in handy to lift the burden of paying for services from the consumers. The problem is when patients go to dispensaries or health centers, there are no laboratory services, there are no drugs. So as much as someone has a card, they're not able to get a service. So even the facility cannot now claim from NHIF for a service rendered. So most of our patients now will elect to go to private facilities instead of government. So my role as a CEC for health is to change the attitude of our community, to choose public facilities as their preferred facility of choice. And therefore, through that, we're going to tap the revenue and help our facilities grow. As I come to the tail end of the question.
Yes, I'll join on that one, Chair.
Yes, Honorable Barasa. Sorry, Honorable James Joseph Nyongesa.
Yeah, whereby Dr. Andrew is saying that sometimes we have no drugs in our hospitals. And as you know, Speaker, we have been approving budgets here. The lion's share has always gone to the health sector. Now, this issue of maybe lack of drugs in our hospitals, what could be the challenge? And how will you do about it so that at least this issue, we take rid of it so that our people get proper services? Because the lion's share has always gone to the health department.
Yes, Dr.
Through the chair, I agree that health is among the biggest devolved units or devolved services, and as it is now, health takes the greatest budget of Bungoma County. However, I want to state here that as much as a lot has been given to health, still health consumes a lot in terms of recurrent expenditure on salaries. We have a lot of money going to pay salaries and wages. Also, having said that, is our population has not been mapped out. The procurement of drugs is based on historical allocations. As a CC for health, I'm going to ensure that we map out diseases in every sub-county, in every ward, so that as we are procuring drugs, we know the targeted population that's going to receive these drugs. And that is going to ensure social accountability and community participation in safeguarding our drugs in the facilities.
Then, Chair,
yes, Honorable Joseph.
In fact, say that most of the amount is normally gone maybe to the issue of recurrence, that's paying of salaries. But, Chair, another challenge in that sector is the nurses, doctors are being paid by the government. Drugs are being purchased by the county government. But when it comes in terms of billing, Honorable Chair, our patients are really suffering. They are overcharging, in fact, more than even the private hospitals. So I don't know, as a CEC in that docket, what could you help our people on that?
Through the chair, I'm aware of the challenges that the honorable member has raised. Before us, we have a pending work of enacting the healthy financing policy. We want to rationalize charges in the facilities. When we sit here, we have to know in Naitiri how much does it cost to do a full hemogram. We have to know how much does it cost to do a lab service in Mechimeru. As it is now, sub-counties have disparities in charging, and therefore patients complain, yes. As honorable members who represent those people, you can't do much because we rely on our reports. And also for us, we find that the hospitals are a bit autonomous because they are controlled by the boards, and therefore the charges have not been regulated. So one of the assignments ahead of us going forward is to enact health financing policy so that we're able to rationalize charging of healthcare services.
Now, before I allow Honorable Kirong to come in, just to seek from you, so I'm going to come back to you, Honorable George Makari. Doctor, we've had challenges where you purchase drugs, you stock in your pharmacy, then they disappear. Like they disappear through the hands of your employees in the departments. Is such a challenge? How do you want to basically control it?
Through the chair. Also, drug surveillance is one of the key components that we have to do as a ministry. We have to store control cards, but historically that's not been enough. So we are looking at installing surveillance systems in our pharmacies to ensure that drugs are able to be monitored even from the central level. Remember, we have before us the task of coming up with e-health, where we have to interlink all the facilities in the county, and therefore it's going to give the county pharmacist latitude to be able to understand what happens in the peripheral sites. But as it is now, we are relying on the manual bin cards, which can be manipulated, and therefore loss of drugs. We can't really guarantee the public that the drugs that have gone to a certain facility are safe. So I believe once we have the e-health system running, we will be able to curb such, Mr. Chair.
Thank you. Honorable George Makari, finish your question.
Yes.
The minor part of my question. On
Yes,
public
then
health.
I go to Honorable Girong before I come to the other side.
About the public health funds, we know that there's been a challenge. And through the chair, going forward, I will seek that maybe we address that challenge because, first of all, the public health officers have not been capacitated to go around to do their work of inspection of food premises and licensing.
But Doc, before you proceed, they collect money, they put in an account, which themselves, they can't access the money they collect. Now they get stuck because they can not use the same money to fuel their motorcycles or vehicles to go to the field.
Okay. Right from devolution, the hospitals and the public health officers were instructed to bank all the collections in the county revenue fund. We had challenges accessing funds to buy drugs and pay the casuals and run other services. Luckily enough, through this house, we're able to enact the Health Services Act, which created the Health Services Fund. That fund has enabled the hospitals to run. The Public Health Department was the 11th facility that was empowered to collect funds and spend. It's now a shock on me that as much as the hospitals have regularized that one, but the Public Health Department has not. So the first assignment for me going in is to make sure that the Public Health Department is the 11th facility that's going to collect funds, bank, and utilize the funds to run their public health activities.
That's good, Dr. Now, just a final one on the same. There is a lot of mismanagement as a committee, which I chair the Committee of Health. I'm glad my committee clerk, who was a previous committee clerk, Momos, is also here. There's a lot of mismanagement at the county referral hospital. And some of the money collected actually has been being used in political activities. Maybe you are not aware because you are in Cuba. But if you follow
He was aware in July, so he must be aware. He can't feign ignorance over the same. He was aware.
He was aware.
Yes.
So as a CEC, what are you going to do about this? Because if you want to go ahead, you must also look back a bit. Because some of the collections there, we know, we are very much aware.
Thank you. Through the chair. Health services funds are not arbitrary funds. They are supposed to be managed according to the Public Finance Management Act of 2012. And therefore, I believe, and we are going to ensure that we do a thorough audit of the finances for the last financial year and up to where we have reached, and also strengthen our internal audit mechanism so that we're able to, you see, corruption is better prevented than dealt, because it's hard to root out corruption because it fights back. So to prevent corruption, we better enhance internal audit mechanism, checks and balances, so that money cannot leave the facility without the approval of the senior managers of the finances in the department.
Thank you, Chair. Back to you.
Thank you. I'll go to Honorable Kirong.
Thank you, Chair. Doctor, the department has been notorious for spending grants as well as revenue collected at the source prior to appropriation by this county assembly. Do you commit to observe the provided budgeting and expenditure procedures?
Through the chair, yes.
You will?
Yes.
Okay.
Honorable Luseneka, there is this idea of, we always hear in the villages, that whenever we have a drug shortage in the hospital, the medics send you to a specific chemistry to procure drugs. They refer you to the specific chemist to buy the drugs. What is the problem with that?
I believe in our medical training and ethics, a clinical officer or a doctor are the ones who prescribe drugs. They are not allowed to elect a pharmacy or a chemist where a patient will buy the drug, because providers have their choice. So if the drug is not in the facility...
Like that's what you are taught in class professionally.
Yes.
Do you practice the same in your place of work?
As an individual, Chair, yes.
No, you as your medics, do you practice the same?
Honestly, Chair, I've heard those stories that people are sending patients to buy.
So you are new in Jerusalem?
Hmm?
You are new in Jerusalem. You hear those stories every time that patients have been sent to specific chemists to buy drugs.
Yes, I hear those stories.
Yes.
Yes.
How do you intend to cure those mischiefs?
So, as a CC, my role is to ensure that there's proper accountability structures that are put in place, and the service charters, patients must be enlightened. They should be aware about their provider, their consumer rights, and also to curb these menace is to ensure that our pharmacies are well stocked with drugs, so that the provider will not have an opportunity to send a patient to pick drugs from somewhere else. This we did in Kimilili, and we saw the pharmacies along the road to the hospital, they all collapsed because we had drugs in the facility. So I believe once our facilities are well stocked, patients won't be seen crossing the road.
You are lucky that the chair of the committee that is going to oversight your department is here and is listening to what you are saying. He is good at inspecting those chemists on regular basis, so be prepared for that. Yeah. And the members are here, so what you are answering, you are unanswered. And they be sure if we approve you, they'll be visiting those pharmacies to confirm, do we have drugs or not? Honorable Seneca.
Maybe just a quick one, Chair, before
Seneca comes in.
That issue of maybe spending from the source.
Yes.
You know, where I sit, I'm not so satisfied about it, because we were told that it was through a cabinet resolution that made them start spending from the source. No, when the Secretary tells us that he will not do so, I don't know how.
Through the chair, the issue of spending at the source has been there, and I believe it's still there. What matters a lot is about our ethics as managers. How are we able to follow the prescribed legislation? There's a PFM Act, which is very clear how we should be spending. Management by crisis is no management. I believe if we do proper procurement, we'll be able to have commodities that we run for us enough time as we prepare to procure the next consignment. So my role as a CC is to ensure that all procurement officers are active and they're doing their work in a timely manner so that we don't run in shortages of commodities to force people into spending at source.
Yes, Honorable Seneca.
Thank you, Chair. Chair, I have 2 questions. The first one is, Daktari, have you ever handled a case of professional negligence?
I have not per se had an issue with my conduct as a doctor, but I have had a case in Kimilili where one of the staff members was accused by a member of the public of professional negligence, and we tried to pursue it to the logical conclusion, and the complainant was settled.
I'm asking because there is an instance that happened last month where a patient was prescribed wrong medicine, wrong drugs by one of the officers, and the patient passed on. Your system, the way the system works is that the medical officer clicks on the drug he wants maybe prescribed to the client, and unfortunately he clicked the wrong drug, and unfortunately the patient was given that drug. I want to know what measures can be put in place to prevent such a thing from happening. Because from the records, it's like what the doctor says is what the pharmacist will do. No counter checking. So, how will you prevent something from like that from happening again?
One of the things that we do through the chair, please, we need to establish a quality assurance unit. Even the Health Services Act that this House passed gives us the clear instructions to establish quality assurance unit. No one is perfect. Mistakes do happen. And therefore, with that unit, one, we will ensure that all professionals providing care to our people are duly licensed. You know that nurses and doctors and clinical officers, they have to renew their practicing license every year. That's the work of that unit, to ensure that they start compliance to statutory obligations. 2, at the service delivery point, we know that there's risk of administering the wrong drug to a client, and therefore we have to provide registers. If that kind of thing happens, is documented, then we institute measures to prevent such occurrence in future. So always we have an occurrence book where we document such kind of complaints.
Thank you. Question number 2, PCRH. We don't have a CT scan. We don't have a mental unit. Do you have any plans, maybe once we approve you, of putting up such a facility? Because our patients, our brothers and sisters are traveling all the way to Eldoret to seek such services. And yet these are level 4 hospital that is serving people from even Uganda.
Okay. Through the chair.
Yes.
From the governor's speech, he committed to ensure that Bungoma County Referral Hospital is made a truly referral hospital. And by that it means that we have to ensure that we offer specialized services. So in radiology, CT scan is one of the specialist services we're gonna offer. So we have to look for ways of putting that in our budget in the next financial year to ensure that we have the CT scan and if possible MRI, because these 2 tests are complementary. They work together. If you miss something on CT scan, you can get it on MRI. And therefore, we don't want patients to go to private facilities or travel long distance to seek these services.
Lastly, Chair, Dr. The health sector is known to experience numerous instances of staff unrest. What approach will you use to manage strikes that occasionally interrupt service provision to the general population?
Through the chair, staff unrest, they don't just appear. They have a genesis. One of the genesis is failure of the employer to meet their bargain in the collective bargaining agreement. 2, is poor working conditions. And 3, lack of grievance redress mechanism. So for me as a CC, I've been a member of the union, of the Tutors Union. I sit with these people. I sit with the nurses. I sit with the clinical officers. We know each other. I believe we'll pursue all the avenues for grievance redress before we reach the point of staff unrest. Because staff unrest in healthcare, this is suicidal because it means patients are going to die during the strike period. We are going to lose a lot of, and a life lost can never be recovered. So I'll strive to the best of my ability to ensure that we prevent staff unrest.
Thank you, Honorable Vitalis.
Okay, thank you, Chair. Doctor, you sometimes or recently there's so many livelihood whose were affected due to COVID-19 pandemic. What would you propose as a leverage on sanitation, education, and behavior change in order to strengthen our readiness during disaster or such emergency?
Through the chair, I want to state that every pandemic gives us lessons. COVID notwithstanding, the culture of hand washing had been forgotten. The culture of maintaining social distance had been forgotten. The culture of wearing a mask, we thought only mask can be worn in theater. COVID taught us that those simple tasks, like washing your hand, avoiding close contact, like shaking hands every time with people, we minimized infections, both diarrheal infections and upper respiratory tract infections. So for me, I say, not only the doctor, not only the CC, all of us, because health is not left to the health sector alone. Health is for all of us. Let's ensure that the public is made aware of the preventive measures that can be taken to control respiratory diseases and diarrheal diseases. So now we have Ebola in Uganda. It's not very far from COVID. The measures are almost the same, separation. So for me, I believe we need to continue with mass education of our people. We need to ensure that there are hand-washing facilities in schools, in homes, and even in the marketplaces. Because during COVID, we saw those are the things that actually helped us as a country to fight the pandemic.
Yes, Honorable Tiembu.
Thank you, Chair. You know, this exercise is very tiresome, but to the nominee, in your own considered view, how does the procurement and the distribution of drugs affect the provision in the healthcare of Bungoma County?
Through the chair, procurement is a very integral part in our management of health services, because after budgeting, the next step is implementation of the budget. So how do you implement the budget? Is to make sure that you procure services and commodities. So procurement is at the center of financial management, and therefore, if procurement fails, it means we can't consume our budget, and therefore we'll be left with unutilized funds. So for me, procurement is just is the backbone of provision of services.
Yes, Honorable Chemion.
Thank you, Honorable Speaker. To the nominee, I'm aware that you have served as a very important person in that department. you must be aware of CHVs and the role they play. Could you be able to inform this committee how many CHVs do we have in Bungoma County? Then, how much stipend is paid to them on a monthly basis or a given period? And 3, is a stipend paid regularly to these CHVs? And finally, what proposals do you intend to implement to actualize the governor's proposal? You know, the governor has proposed that is going to do much in officially recognizing the role of community health volunteers. And he has even gone ahead to say he's going to enroll them on a sustainable monthly stipend. To you, what is this sustainable monthly stipend? How much money will they be paid per month? Thank you.
Okay, through the chair, I want to state here that Bungoma County has 354 community units and therefore has 3,540 community health volunteers. Out of those, only 260 are not receiving a stipend every month. And this, I'm told, is already factored in the budget. The issue is just pursuing it further to ensure that they get their stipend. They get stipend of 2,000 Kenya shillings every month, but how regular, I cannot ascertain because I have not been, since I came from Cuba, I just went straight to the hospital to help set up the family medicine unit. So it's a matter to check. But going forward, to ensure that the governor achieves his manifesto, we have to ensure that the stipend is reasonable. You know that the cost of living has gone up, and even the CHVs, their facilitation is not adequate. Most of them walk on foot across the villages. So, through the legislation of community health services, I believe it will guide us on how much we should pay a stipend, and also it will be able to ensure that these HWs are considered as community health workers as opposed to community health volunteers, and therefore it ensures that they are captured in our establishment, in our staff establishment, and as providers of healthcare service at Tier 1, which are community health services. And this will guarantee their existence going forward.
Chair, do we have a policy that guides the recruitment of these CHVs and their enumeration? Would we have something that guides that?
Through the chair, what I remember, community health strategy was a brainchild of the national government. And during that time, there was a framework which outlined who is eligible to become a CHW, and it is the one that recommended the 2,000 shillings as stipend. And therefore, for us, Bungoma, we need our home solutions because we are the ones who live with these people, and legislation is also part of our responsibility as a county. We can enact our own legislation to guide us on what to do with the CHVs.
Yes, Honorable Stephen Omarwa.
Thank you, Honorable Chair. I have a question to the nominee. Now that you look forward to becoming a CCM in that docket, the health sector faces many challenges, ranging from congestion to lack of drugs and not forgetting rampant corruption. If made the CECM, what measures will you put in place to improve service delivery and ensure decongestion, especially of the county referral hospital? And how you can empower those level 1 and 2 practical approach to the same.
Through the chair, I want to draw back to the lessons learned during COVID. COVID taught us that no country has capacity to admit its people in the hospitals. China tried, it failed. We cannot say we can manage all our people in Bungoma County Referral Hospital. We need to decentralize. And decentralization has only one medicine, primary health care. Primary health care is a function of the county government, specifically health department. Through adoption of the primary health care strategy, we are going to ensure that we are giving outreach services to the community. We are going to make sure that the facilities in the community, in the rural areas, they are fully functional and equipped. 3, we are going to ensure that staff are provided to ensure service, because health is not just brick and mortar. Health touches on 7 pillars, and human resource for health is very integral. Pharmaceuticals and other commodities are very integral. So for us to decongest Bungoma County Referral Hospital, I believe, and I'm sure we will do it, that we are going to ensure that all wards have functional health centers. It's easier to carry a doctor to the location than carry a location to a doctor. We better equip the health centers to ensure that services are being provided there.
Yes, Honorable Grace, then I'll come to Honorable Joseph.
Thank you, Chair. Which criteria are you going to put in place on hospital bill waiver so that it benefits that lowly person in the community, instead of benefiting patients related to workers in the Ministry of Health, as you have been doing while you are being a medical superintendent in Kimilili? I know you are giving waivers to only those people related to your colleagues and retaining an AFLA for a bill of 1,000. Thank you.
Yes, Doctor.
Through the chair, this is a new allegation, but none the same, I will respond to it in a broad manner. Waivers are part of our healthcare management systems, because public health care is non-profit organization. We're not here to make profits, because we treat street children, we treat orphans, we treat travelers. People are traveling to Rwanda, they pass through here. Someone falls sick, is a truck driver. We treat them. Some of them, they can't pay. So in the wisdom of the designers of the system, they felt wise to have medical social workers. These medical social workers, their role is to identify patients who cannot pay, and they go do community checks with the administrative units, the location and the sub-location, to show that actually this person is not able to pay, and they'll make a report. And then there's a waiver committee that sits to discharge those patients without paying. So the allegation that Dr. Amalwa discharged people, gave waiver to his friends. I don't have a family in Kimilili. I don't have friends in Kimilili. Therefore, all those that were given waivers actually made it to get waivers, and their reports in the waiver file.
Honorable Joseph.
Just on the same, Chair.
No, I had spoken of going to Honorable Joseph. I'm coming back to you, Honorable George. Kindly, please. So the senior has to come ahead of you.
But we are all members here.
Yes, we are all committee members as put by...
Just maybe a follow-up of Honorable Grace's question. Maybe, Dr. What do you normally base on during the issue of waiving the bill? Then, Speaker, we have a 300 bed capacity here within us, which was started by the outgoing regime as a CEC.
What plans do you have? When can you equip it so that it can start functioning?
Through the chair, giving a waiver, we hold it depend on the report made by the medical social worker, because they're the ones who are trained and they are mandated to visit the household to ascertain that actually this person is poor and they cannot pay. So the criteria of how to determine the poverty level of that person, I believe I can get it from the medical social worker, and I believe all patients can be assisted for those who are not able, truly unable to pay. There's something in health economics. We talk about willingness to pay. Someone can be able to pay but not willing, but another one is not able to pay and can't pay. So we're only going to give waiver to the people who can't pay and not able to pay, not people who can't pay but are able to pay.
Thank you, Honorable.
So
now,
that issue
George
of 300 bed capacity.
Sorry, Chair.
It's okay. You explained the issue of the bed capacity.
There's a question about the 300 bed capacity. This is a big project, and as we welcome the project because it's going to assist the people of Bungoma, but this is a long-term project. Fully equipping the facility, you will put brick and mortar in place, you'll put machines there, but without the personnel, also you can't run it. So with our budget, what we have planned is to do incremental procurement. We are going to employ, according to our plan in health, we're going to employ human resources starting this financial year. This financial year, we are going to employ 182. Next financial year, we are going to employ 200. The next 200, up to the end where we shall be able to employ around 900 personnel. Some of them will get chance to serve in the 300 bed capacity. And likewise, we are going to factor in the budget equipment for the facility every year 50 million to ensure that by the end of this 5-year term, we'll have equipped that facility.
I think, Chair, it's being funded by the KTSP support program.
Through the chair, please, you'll allow me to get the details right, because I'm not yet confirmed. So the information I have is what I've been able to gather. I've not been handed over the projects yet.
It's okay. Honorable George Makari.
Thank you.
Then I'll have Honorable Grace.
Thank you, Chair.
And the one up the Honorable James Barasa.
Thank you, Chair. Maybe
Honorable, we are on camera.
Dr. Wamalwa,
yes.
If becomes lucky, is going to be a CEC for health, not later than maybe next week. Now, there is an issue, Chair, about casual workers at the hospital. And this is Bungoma referral, and then it is replicated down to other hospitals across the county. But you will find that these people, there is a cartel within the hospital that keeps on recruiting relatives on a 3-month contract. Any person outside cannot penetrate. And if you are lucky enough to take your a person that is on your neck to go there, he or she will serve only 3 months and is thrown out. But their own people within that cartel at the hospital, they keep going on and on and on for years. As a CSO of health, Daktari, what are you going to do about that if you come in?
Through the chair, one of the principles of public service is impartiality. We should not practice nepotism or tribalism, and we should give equal chance to all communities. So I believe what the honorable members just described is favoritism and maybe nepotism, which are reprimandable acts in our public service. And as a CC of health, I'm going to ensure that all community members of this county get a chance in public service at whatever capacity through a fair competition and on merit. So for those who merit, and if
Nominee,
yes.
are you aware of that existence of that cartel?
I've had.
You've had.
I've someone who lives here. I have had.
Yes.
And we are going to ensure that the rule of law takes course.
When you were in Kimili, was that cartel in Kimili also or not?
When I went
When you were in
there,
Kimili,
yes.
Was that cartel there?
During my tenure, it didn't exist.
It didn't
because we were
exist.
giving chance to casuals who come every 3 months. They go. So we had 2 pools.
So we are asking that cartel of bringing their people every 3 months.
Yeah.
Were you aware of its existence in Kimili or not?
That it was not there.
What of Sirisia?
Seriously, I served in the hospital only for 6 months, and I left. So at that juncture, or at that point, I didn't see that.
You've been here for how long?
Here, I've been here since July.
July. 3
Yes.
months have lapsed. Are you aware of that cartel also? Here.
And Chair, is the same cartel that interviews the casuals that come in. So they keep on renewing their relatives only. So maybe Dr. Rican.
Are you aware of that cartel here, the
Also,
referral
Chair,
hospital?
because we're on record,
Yes.
I don't want to lie because I've not been in management of the facility, so I don't know how they've been handling casuals, and also I've just been getting the reports from.
But in your goals of your duties, you've been meeting the casuals.
Yes.
How they come in, they go out, you don't know.
I don't know.
It's okay. Now we had Honorable Muhongo.
You know, Chair, mine was more of a comment, but something has just come in my mind.
Please proceed.
In the previous regime, Honorable Chair, we had a CEC from Umula and the chief officer from Kimelili. When you heard of a flagship project, it was either Umula or Kimelili. You are coming in. Will you also practice the same, or you will change the pattern? Because some sub-county hospitals have been left out for the last 5 years without even a single construction, like Ichwele. Because you have worked in this department, I know you have been. While you are going to Serisha, you are passing at Ichwele. And looking at the catchment of Ichwele, we have patients from Mount Elgon. We border from Kimilili, they were also coming to Chwele. Serisia, even Kabuchai sub-county as a whole. So my brother, you need to do something for those areas that their CEC is not from that region. Secondly, I have listened to you very carefully, that while you are serving in Busia and even other parts of our county, you are initiating or opening new dispensaries. I don't know if you have come across, because you have been working here in Bungoma, I don't know if you have come across, there is a modern dispensary that was constructed by then the Member of Parliament of Serisha, that is at the moment the Speaker of the National Parliament. A modern one, 95% complete. Because of the politics, the people of that area were denied the operation of that dispensary. I want to hear from you, if you will be nominated within a certain period. I want you to assure this honorable panel, because we are keeping records. What will you do, my brother?
Through the chair, I want to say that I will serve the people of Bungoma with all manner of professionalism and ethics, without favor, discrimination on either gender, disability, or any form of discrimination. Bungoma County faces a lot of health inequalities and iniquities. Where we are sitting here, we are in township. Township ward does not have a single public health care primary facility. We don't have a dispensary, neither do we have a health center. So when you talk, even a Halaba ward does not have a dispensary or health center. So when we talk about marginalization or inequality, where we are sitting here today, people of Kandui, they are facing inequality, yet they are at the heart of Kandui. So for me, we are going to revise to ensure that let's focus at the ward level. And it's the members of the county assembly who are going to direct us. Because the constitution wants us to do community participation. Let's ensure that we make every ward to have a functional health center. And then we go down further to make sure that every sublocation has a dispensary. And this we will agree. In case one ward has got 5 sublocations and they have 3 dispensaries, which means they're lacking 2. But there's another ward with only 1 facility. So you better give that ward with only 1 facility the 2 dispensaries so that it comes to par with 3 dispensaries as we move progressively. I know we cannot achieve it during the Lusaka tenure to make sure that every sublocation has a dispensary, but we need to strive through the participation of the community, through the elected leaders, to ensure that we are fair and we are trying to reach the community as far as we can.
Thank you. Now, as I'm asking you the second last question, I've been looking at your Higher Education Loans Board certificate that you brought here. It's expired. It's a 2015 document. And after that, I know you've gone back to school several times. So is it okay?
Through the chair, I only benefited once for the loan from Higher Education Loans Board. And the certificate was issued in 2015, having cleared my loan that was given for undergraduate studies. However, I was guided by the clerk's office that I should get a compliance certificate. I've been camping at the Huduma Center since Monday. The services has been down. I've not been able to get a compliance certificate. But I don't have another loan that I took.
There is no evidence of you lacking a loan before us from the Higher Education Loans Board. There is no evidence.
Chair,
evidence could have been a certificate of clearance. Now, lastly, this is important for this House and for me as a speaker.
Chair, before you final.
It's okay, Honorable Senator, you have something?
Yes.
Yes, please.
Chair, I wanted to know from Dr. how he will tackle the shortage of essential commodities like condoms and HIV kits that are out of stock at the moment.
Repeat, I didn't hear well.
Maybe the chair can repeat.
No, when a question has come from a member of the panel, it's good that it's loud enough for you to hear. I only interject if it's clarification, but I think being a minority leader is only enough because it's supposed to oversight you people properly. Yeah. Come again, Honorable Seneca.
Secretary, I'm saying I've received complaints from my people that there are no condoms at the hospital. And the HIV kits are also out of stock. And yet these are very important.
Say they are essential tools of trade.
Yes, essential commodities. What are you going to do about them?
Yeah, through the chair, I'm aware that the department has been facing issues with the measures that have been put in place to prevent and control the spread of HIV. And condoms is one of them. We envisage to procure enough condoms. You remember, HIV is one of the vertical programs run straight from the Office of the President. So, given this opportunity, I will engage closely with the CS for Health to ensure that Bungoma County, being one of the endemic areas for HIV, we get the facilitation of HIV kits and other commodities that are used in the prevention of HIV.
Okay, thank you, Honorable Seneca. Lastly, Dr. I'm asking this question on behalf of this committee and the entire House. In our new standing orders, the chair you are sitting on is now going to be reserved for the CCs and the chief officers. In our new standing, you'll be summoned by the various committees for answering some queries or clarifications. If we summon you tomorrow, if we are able to confirm, will you be able to come before this committee?
Through the chair, yes, sir.
Because we have the history of people becoming animals and they don't want to appear before us, but we want to have money from this assembly in terms of budgeting. You will appear in compliance.
Yes, sir.
It's okay. Thank you. Have a good evening. I think it comes, we bring to the end for today's interview. You are free. There's no tea for this evening hours. At least you can take tea where you always take for your evenings.
Thank you, Chair, and all the members.
No,
for
but I think let's hear your closing remarks. I'm very sorry, I think I was ahead of time. Your closing remarks, please.
As we come to the closure of this discussion, I want to thank the Chair and all the members for being so hospitable to me. The questions have been very insightful, and the discussions have been very engaging. And I think it opens our eyes to ensure that we focus on the goal of serving our people going forward. I will remain honest, and I'll remain to the service of the people of Bungoma, and I'll remain accessible to this house and the members of this house. Thank you so much, Chair.
Thank you, Dr. I've been told by one of my officers that we have a cup of tea behind here in a tent. We welcome you to join the honorable members and our staff for that cup of tea as you go and keep on praying that this committee finds favor in its wisdom and approves you or proposes your name for approval before this house its sittings next week.
Thank you.
Thank you. Have a good evening. I think our secretariat, I'll need to have a brief meeting with you in my chamber for next week's planning as members take a cup of tea out there. So we adjourn and we resume our meeting on Monday at 8:20 a.m. in this plenary again. Thank you.
The hot seat.